relation to pain management and also the opioid element of things. Can you give us a little bit more of a sense of the where we're at with pain management and phytocannabinoids?
You know, I just spoke in London at a dinner, and I was speaking about the opportunity for cannabinoids in pain management and as a tool to combat the opioid crisis. And I said, is it as bad here? And there was an emphatic no. Like, you Americans have really screwed the pooch on that. So, for those of you who don't know, the opioid crisis in America is very, very real. The United States is definitely suffering from it. I know that does occur elsewhere, and hopefully it's not to that extent. But we are certainly in a crisis, and we need solutions. So over 70% of people who use heroin originally started with a prescription opioid. And these are really, really difficult medications to get off of, whether or not you have a substance use problem or you don't, because you will be physiologically dependent on them. And in the 90s, you know, practitioners were told these are not dangerous and they're not habit forming, and obviously that was not the case, the reality. But we were misinformed. And so now we have this problem, and people are in pain. You know, we learn pain is the fifth vital sign. We need to treat it. And if we just withdraw opioids, we may lead them to the illicit market because it's cheaper and it's easier to get, and the withdrawal is really, really terrible and is a major barrier to getting off of these medications. Number one, withdraw. And two is people are in pain and we need to treat their pain. So we don't have great alternatives. You know, we have maintenance therapy, which is controversial at best. But when we look at cannabinoids, there's really an opportunity there, and particularly for CBD. So CBD is going to be the cannabinoid the word is not psychoactive. I don't love that word because it's anti-anxiety.
It has very particular connotations to it as well, right?
Yeah, it's like it won't intoxicate you.
No.
You know, THC will intoxicate you, particularly at high levels. CBD won't. So we know that cannabinoids in general, so speaking of both CBD and THC, have pain management potential. The National Academies of Science, Engineering, and Medicine did a meta-analysis. JAMA, so the Journal of the American Medical Association, did a systematic review. Both of those bodies, who are pretty well respected, concluded that cannabinoids were effective for pain and pretty well tolerated. We also know that they don't have the addiction risk and dependency potential of opioids, and that you cannot physiologically overdose. You know, you're not going to have respiratory depression when you're accidentally overdosing on these. The worst thing that's going to happen is maybe you need 5 bags of Doritos.
Yeah.
And that's really only with THC.
Gastric distress.
Yeah. So we see, one, that cannabinoids are effective for treating pain. And this has really been established time and time again in the research across different pain modalities. And that's probably where we have the best research in cannabinoids and pain. So we know it's effective. And then two is it safe to use in conjunction with opioids as an adjunct? Because we worry about adding anything to an opioid regimen and increasing the risk of respiratory depression. Well, pharmacokinetic studies show that CBD does not increase the risk of respiratory depression. There's some limited evidence that THC doesn't either, but it just hasn't been studied as well. Okay. But most of us don't, it does not appear to.
Yeah.
So you're going to treat the pain, you're going to treat that fifth vital sign. It's safe to add to that regimen, not going to increase respiratory depression. So it may help better manage pain, but also maybe a nice alternative as opposed to a benzo for anxiety or hypnotic for sleep that does come with that risk. And third, there's some really good evidence that's been emerging very recently about CBD's potential to decrease opioid withdrawal symptoms and to make people more successful in titrating down because they're not experiencing anxiety, nausea, palpitations, diarrhea, all of that comes with this really unpleasant experience and barrier to titration. So you're treating the pain, you can add it as an adjunct safely, eventually, when someone's ready to titrate down, this is going to help them do it more. And lastly, there's some emerging, very promising evidence, although mostly in preclinical models, that CBD may actually help with substance use disorder.
Wow.
Yes.
Okay.
Whether it's opioids, cocaine, and alcohol, we're seeing that pretty remarkably in animal studies.
Wow.
So that's it. There's a huge opportunity here. The safety profile is just so much better. But there's problems. I mean, it could cause someone to fail a drug test, and a pain management clinic might be drug testing you. You can take opioids, but you can't take CBD. So there's policy and politics that are need to evolve.
Great situation. I wanted to ask you about pain management and maybe the application of pain management in relation to CBD, as far as how we can potentially identify people who might benefit the most from it clinically. Are we further enough down the track to associate particular conditions with CBD yet, or are we looking at still trying to work that out? Is there a possibility that we can just say, hey, if you're experiencing an inflammatory process, because look,
most things are, right?
I've taken enough CBD now to think that if I've had a rough day at the gym, my joints are feeling pretty good afterwards, and I think I've had some experience with my patients already as well. I mean, are there any particular conditions that have come up on your radar? Is there anything you want to comment on in relation to that?
Yes. So neuropathic pain has been pretty well studied.
Really? Okay.
And looks very promising. So across different etiologies of neuropathic pain, particularly chemotherapy-induced peripheral neuropathy is a really big interest area of ours right now, and we're going to be studying that in humans this year with some experts in the field, in the oncology field. In animals, if you use CBD in conjunction with these chemotherapy agents that have such a high incidence of causing CIPN, it eliminates it from ever forming.
Right.
So, we have to do the work on treating it first. The FDA told us.
Of course.
Even though we have so many case studies, we have some research, but we need to do this FDA-approved trial, and then we can and safety study, and then we can back up and hopefully prevent it in the first place, because it seems to work better for prevention. So neuropathic pain, and if someone's ever using a topical, which is a great use, I prefer an ingestible for daily use. The topical is great as an adjunct. If it's neuropathic pain, I'd also apply it to the dermatome associated with that pain.
Right.
Yes.
Okay.
Now, there are not studies about
No, that's okay, but we're here to treat people and get people better, right?
But when I first heard it, a colleague of mine was using it that way with a lot of success. I'm admittedly quite skeptical, but have become a convert. So with neuropathic pain, certainly to the site, if you're using topical, also apply to the dermatome. So neuropathic pain would be the low-hanging fruit, maybe, in pain.
But also one that's difficult to treat. You're getting a lot of people using Lyrica and with varied results as well. And obviously the diabetes, neuropathy is a huge complication.
We see a little bit of vasodilation too, so that would be nice for that population. And the National Pain Foundation did a study on fibromyalgia patients. Found that Lyrica, Savella, and one of the other very common prescriptions for fibromyalgia that's escaping me, were effective maybe 5 to 10% of the time. But cannabinoids, it was about 68% of the time.
Okay, that's a huge differential.
It was really inverse response rates. Only 5% of these, it was 1,300 patients with fibromyalgia, said cannabinoids didn't help at all, where it was about 60+% for the prescription meds. So neuropathic pain and these really difficult to treat symptoms are definitely a good population to target. And musculoskeletal as well. I mean, anything with some sort of inflammatory etiology.
Having a rough day at the gym.
Yeah.